Right, right. And the thing is that I know the lobby wants to not have a special session in June. Obviously, they think that revenues are going to kick up, and that as a result, we're not going to need a special session. And one of the things I asked Steve Wagaspack on Twitter, well, okay, fine. I don't necessarily disagree. I mean, that's how I felt. But the problem is, what do you tell the universities? They got a plan, and how do you plan unless either you cut and you know what you're going to cut and you know what you're not going to have, but you got to tell the students what is the future, this summer in order to plan. So how do you not have a special session and just get it over with one way or the other?
Well, I think you have to have a special session. You have to try. I mean, I'm taking his side. I'm not taking lobby's side. You're asking me, and if I'm the governor, I got to have a special session. I have to make the attempt. If he doesn't do that, his critics, the critics would come out of the woodwork, and it won't be Republicans. It'll be his base, and it'll be the media, and be universities, and it'll be the people who would be affected, the employees. So, yeah, it's a nice suggestion by lobby, but it doesn't apply to John Bell Edwards in his particular situation. John Bell Edwards has to have a special session. If he doesn't, it would certainly politically damage him with his own people, and especially the universities and all of the people who will eventually be who would eventually be affected. If he can't raise the money, he can point to a lot of people and a lot of groups and legislators. If he doesn't even make the attempt, I mean, it would be almost. Oh,
sure, no, he's going to make I'm convinced he's going to make the attempt. Well, but the Republicans could shut the session down just like they threatened to do in February.
Well, they may do it. They've got the numbers, and that's one of the things we're living through. You've got a House that's pretty Republican proof, as we saw. We all have our opinion on what happened as the thing. Should John Bell Edwards have been found more moderate? We had a big screw up right there, and I think that set the tone for that may affect the governor and the House and what happens for the next 4 years. They got into a fight, neither side gave up, and the Republicans won, and he's paying the price now. But so the question is, and your question is valid, will the Republicans shut him down and not raise any money? I don't know. I think that, I will say this, I think the Speaker is a pretty decent guy. He's from Acadiana. He's not a ideologue one side of the street or other. I think my discussions with, if you're Senator Lario and he get along very well together. They have a great working relationship. I think the governor and those guys have got to find some way to get out of the hole. We don't know. I think when the special session starts, I think, Stephen, I think there's going to be a lot more on the table. If there's not a lot more on the table in the choices we have right now, then I think you'll see. But if cooler heads prevail and the governor and these guys all get together and go into a session and say, I'll give you this now, we can come out of it and maybe only have to cut $200 million. That would be a great number for him. So I think it's a matter of cooperation right now. You're right. If there's no cooperation, if there's no plan, and one of the things that bothers a lot of us and a lot of legislators, they need a more, I guess you'd say, there was a plan last year, $700 million hole, and everybody got on board and everybody basically did what they wanted. I don't know if that's possible with this, but it seems to work better when you have a plan and you spell out to the public what exactly will they get and what they don't get. Remember, I do a lot of tax elections, and you can't pass a tax in Louisiana at the local level without a lot of work convincing the public that the money is going to be not wasted. give them a time frame, tell them who the contractors are. Anytime you're involved with a tax, I think the more explanation, the more convincing you are. So I don't think the governor and the leadership and everyone. Here's where we are. Let me make this point. The days of anybody just saying, I need taxes because we have a deficit, it's a hard sell. And especially, it doesn't matter whether it's John Bell or Bobby Jindal or David Vitter. Louisiana ranks 49th as trust in government. And it hasn't changed since.
Sure.
This is the worst. We operate on the worst state government of the 50 states. We're 48. So you got that problem, and I'm not digressing. I mean, that is a big factor out there on taxes.
Sure. But the thing is that we're also 50 or 51, if you include Washington, D.C. I think we're 51 in healthcare, or if not 51, at the very, very bottom. And so we're in a situation where we prefer to fund TOPS than to honor contracts with the hospitals. I mean, we don't know what's going to happen with the hospital system. There's a debate going on right now as to whether or not we not fund 4 or we give a little bit of money to each one of them. But we've got to, at the same time, we've got to give money to people who can clearly afford TOPS and make sure that they're taken care of.
Well,
that's not fair. It doesn't make any sense, and it defies the belief that conservatives have that you got to cut.
Well,
okay, yeah.
Look, you're 1,110% correct. It is mind-boggling to me that Louisiana, we hear all these, and here's where the public is. Let me give you a secret on higher education. The people least likely to want to put more money into higher education because they don't believe that it's sufficient and they've been through the process. You look at any poll on giving more money to higher education, you know who's the most resistant?
No, I don't. I'm sorry?
The people who graduated from college. They're
really?
The ones, absolutely. They're the most least likely to want to fund higher education with more taxes. They've been through the system and they don't buy the argument, and they also know that the professors, they know professors and what they make, and they know the universities, they know we have too many. The newspapers don't, but the newspapers run around screaming about higher education like it's the end all of but I don't see the same intensity towards healthcare. General Lennon cut healthcare enormous amounts of money, and I guess the governor and the newspapers are all of the opinion that healthcare is not that big a deal. We got to save higher education, and I never see any effort towards all these hospitals across Louisiana that have been inundated with new patients who are now, you have to treat them. They have a cold, they go to the emergency room, they have we're spending a lot of money on people that shouldn't be at the emergency room, but they're there day and night now. The hospitals have lost an enormous amount of money, and I don't see any big effort to fix that problem.
Have you heard any of the hospital people say they're going to walk away from the contracts?
Well, that was done to get rid of the charity, and those contracts. The lake has 100% reimbursement. I don't know why they got that, and then you have the other ones that was done to. General couldn't get rid of the charity hospital through the legislature, so he did it through the LSU board. Then he had these the state come and move the charities into these other hospitals, and they took over the load. And yet, why aren't they being funded properly? I think, number one, they ought to be funded properly. They ought to be able to justify based on the number of patients, and you got an infusion of money coming into the state with Medicaid expansion, which lasts, a specific point in time. But no, I'm with you. The biggest surprise to me is the lack of attention the state government, whether it's this governor or any governor, gives to healthcare, and what's the game plan? We don't have a game plan for it. And that's the area in Louisiana that I think Louisiana gets the worst ratings. We have maybe the worst system. We don't have the money. The private hospitals are public versus public. Most of those are gone, so now all of those patients are pouring in. And they've been cut a lot of money, all of those hospitals across the state, and yet you'll see editorial after editorial in Louisiana. We can't cut higher education anymore, and I don't see any editorials about what are we doing to fix and give us a first-rate hospital system based on the patient load that is being thrown at these private hospitals that have to treat these people.
Well, it seems to me that, and this is one of the things I mentioned yesterday on Jeff Correa's talk radio show, and that is that, basically, if crime is one of the major drivers of at least in New Orleans and Baton Rouge, of scaring people, tourism, which we really depend upon, then certainly if you have such people who are say mentally ill, and they can't get medical care because the hospitals are shut down or whatever it may be. I mean, all you're going to do is you're going to drive crime up, and you're going to scare people away. And of course, that's a horrible situation. So I don't understand why they just haven't made a connection. I don't understand why the hospitals haven't been out there, threatening to pull away. I haven't heard it. Have you?
Well, the hospitals are at the Capitol every day lobbying. They got got the Louisiana Hospital Association. I've done some polling for them. They're in the forefront of working with, I know right now, Barra on leading the fight to get the money for Medicaid expansion. They're the ones that they would work with any government to use their money to go get more federal dollars. And I mean, that's pretty drastic when the hospitals have to come. They came up with a plan to find money for the state to get more money from the federal government to pay for all these new. That wasn't done by the government. It was done by the hospitals. So again, you're 1,000% correct. In one of the least people, the legislature and the governors pay it. There is no plan to, okay, let's go get some federal money and help Obamacare save us with the Medicaid expansion. But that's not really, that's not going to pick us off the bottom. It is causing us to stay there, and there's no improvement. There's no better outcome for patients. They're attempting to get these patients into these clinics instead of the emergency rooms. Right. It's a difficult process to get people to, at 3 o'clock in the morning, you wake up and they have a chest pain, and they're going to run straight to the hospital. They may have they have pneumonia. But if you've been to one of these places, it is just packed at night. And I don't see any plan out of state government to do anything about it. You're 1,000. Look, there is no priority when you do polls, healthcare versus higher ed. And I don't know if I think I'm going to campaign for governor on that I save higher education. I've never seen a poll showing that is a big deal to the average person. The average person, probably his kids are not going to go to college. We all understand the importance of it, and we understand it keeps our kids here. But when it comes to serious problems Louisiana faces, I I think healthcare is way above higher education in the minds of most families in Louisiana. Remember, you and I were there when I ran the poll on Jindal and him cutting the charity hospital. That was when Jindal fell like a rock. I mean, he felt just tremendous loss of popularity when he started messing around with the charity hospital system. And for reference, by the way, you and I had that discussion. His biggest hit ever on Republicans was when he messed with health care. So Republicans didn't care if he wasn't funding higher education to the amount that higher ed wants it. He took a big hit when he started messing with health care because parents knew that instinctively that our charity hospital system was the hospitals of last resort. And by the way, their kids may not get an education, they may be doing poorly, and they wanted that system available for anybody and everybody. It's like charity hospital was in our genes. We grew up knowing that it was a safety net. When Jindal cut it, that was when his popularity fell like a rock, by the way.
Okay, so like Cameron Henry and the Appropriations Committee in the House, I mean, basically what they, again, you know, they are trying to fully fund TOPS at the risk of not having any real plan to fund health care. And so I guess my question is, I mean, shouldn't they learn the lesson that Jindal should have learned?
Well, the problem is there's nobody on the same page. Nobody's out there saying my first priority. The governor, as I said, my first priority is health care. They're now talking about the partnerships, and we don't really know what the partnerships are and why they don't like them. Cameron Henry is talking to his voters. When he goes back home, he's going to say that I saved TOPS. By the way, it's very popular. He's not going to go back home and say I saved higher education. That's not as popular as TOPS, by the way.
Sure, but they're related. I mean, they're directly related.
But I agree. But you can make the case to Cameron Henry or any other Republican or the governor or anyone else that healthcare is the number one issue in this state that people really care about. We can talk about a rail car between here and Baton Rouge and Yardsbush. By the way, if you did a poll in East Baton Rouge Parish, I would say that of the voters, probably maybe 15% would care. I mean, we have so many other problems in Baton Rouge as you have in Orleans, and we come up with things that to spend money on. That what does it have to do with reality? So no, is Cameron Henry? No, that's not what's really important to the average voter in Louisiana. Is Cameron Henry doing what he thinks is okay for his district or Republicans? Sure. But is it going to help health care? No.